Okay, think about this. We use it every single day in basically every hospital for millions of patients. But what if I told you that one of the most common treatments in all of medicine, we're often getting it completely wrong?
I know, that sounds crazy, right? But it's a hard clinical reality. Just putting a patient on oxygen isn't what gets the job done.
Because here's the thing, oxygen doesn't save lives. Correct oxygen therapy does. That little word makes all the difference. It's literally the difference between a patient getting better and a patient getting worse. So today, we are opening the missing manual.
So you have to ask, how can something so fundamental be so easy to mess up? Well, it all goes back to really understanding what oxygen therapy is actually for in the first place. You know, the official textbook definition is pretty clear. We use it to treat hypoxia, which is just a fancy way of saying there's not enough oxygen in the body's tissues. But look at what it's not for. It's not some magic bullet for every single person who feels a little short of breath. And that leads us to the first huge decision point. When do we actually pull the trigger and reach for that oxygen mask? The guidelines are way more specific than you might think.
We're not just guessing here. We're looking for specific signs, and more importantly, numbers. For most patients, it's an oxygen saturation reading below 94%. But, and this is a big but, for folks with COPD, that target is much tighter and actually lower, down at 88 to 92%. We're definitely going to circle back to why that's so crucial. And of course, if you see obvious signs like major respiratory distress or a change in mental status, that's an immediate go signal.
So, let's say you've made the call. The patient needs oxygen. Now what? This is exactly where you need a clear protocol, a playbook to make sure you get it right every single time.
And here it is, the 7 steps, all the way from that initial assessment to safely taking the patient back off oxygen. Now listen, every single one of these is important, but let's really zoom in on 2 of the most critical ones: choosing the right device and setting the correct flow rate. This is where precision really starts to matter. Yeah, a nasal cannula is fine for mild cases, and a non-rebreather is what we grab in a true emergency. But look at that Venturi mask. It can deliver a precise FiO2. That's the exact percentage of oxygen in the air they're breathing, and having that level of control is absolutely non-negotiable for some patients if you want to avoid some really dangerous complications. And this is why that precision is so important. Look, we are not aiming for 100% saturation. For most people, that 94 to 98% range is the sweet spot. But for our COPD patients, we're aiming for that much lower, 88 to 92%. Why? Because if you push their oxygen levels too high, you can actually shut down their body's natural drive to breathe. This is a classic case where more isn't just not better, it's actively dangerous. All right, so knowing how to do it right is only half the battle. You also have to know the common pitfalls. So let's talk about the mistakes that can have serious, even deadly consequences.
We've already hit on the danger of just blasting a COPD patient with high-flow oxygen. But what about something that seems simple, like a poorly fitted mask? Well, that means your patient isn't getting what you think they're getting. And not monitoring continuously? Come on. That's like trying to fly a plane with your eyes closed. You have to be constantly watching and ready to make a change.
Let's just boil this down to some really simple rules. I want you to think target, tool, and track. First, target. Titrate your oxygen based on the SpO2 reading. Don't just crank it to max and walk away. Second, tool. Use the right tool for the job, like that Venturi mask we talked about for patients who need that precise concentration. And finally, track. You have to continuously monitor your patient. Don't ever ignore signs that they're getting worse. It's all about being precise and being responsive. And you should know, this whole field isn't standing still. The way we think about oxygen and how we deliver it is always evolving, and it's all moving toward even greater precision. New tech is really changing the game here. Things like high-flow nasal cannula, which delivers warm, humidified oxygen at really high rates, is helping tons of patients avoid having to be intubated. The entire philosophy is shifting away from that old one-size-fits-all approach. Now it's all about targeted, prescribed therapy, often hooked into smart systems that help us monitor patients better than we ever could before. So, after all that, what's the one big idea, the single most important thing you should walk away with? It's a total reframing of what oxygen actually is in a clinical setting. Let this one sink in. Oxygen is a drug. It has a dose, it has an indication, and yes, it has side effects. It's not just air, it's not a comfort measure. It is a drug. And because it's a drug, you have to treat it like one. I mean, think about it. You would never give a powerful heart medication without knowing the exact right dose for the exact right patient and understanding all the potential side effects. Oxygen demands that exact same level of respect and clinical precision.
So the next time you reach for that oxygen mask, I want you to stop and ask yourself this one simple question. Am I just giving any oxygen, or am I prescribing the correct oxygen therapy? Because that distinction right there, that's what really saves lives.